checking in as he does so well and so patiently waiting is our good friend, Dr. Jamie Taweel. I'm glad you're not billing me by the hour because I just left you. Actually, it felt kind of good, Tyler. I got to leave a doctor sitting in my waiting room for a couple of minutes. When's that ever?
Oh, man.
when does that ever happen?
Enjoy it while you can.
Oh, Doc, I wish you could see us right now. We don't have our setup here, so we can see you, but you can't see us. And I look pretty sexy in my red bandana today, I got to say. So
very nice.
Does it sound okay? Can you hear me all right?
Yeah, I can hear you just fine. How about myself?
Yeah, no, you sound really good. So governor's executive order over the weekend, it was actually Friday afternoons, got us all wearing masks. Any thoughts about these cloth masks, the masks we're making? Any thoughts, recommendations from you, Doc?
Yeah, you're ultimately going to want the mask to limit the amount of transference of this, potentially dangerous virus. So what I want you to do is make sure that the mask is going to be thick enough to, really restrict some of that air. I don't want you to, don't want you to choke yourselves by any means. I guess there was a makeshift rule of thumb that if you can blow a candle out the mask, from about a foot distance, I think that the mask is not working well enough. So you want something to be that's going to try and prevent some significant transference of air, but obviously you don't want to be choking to death. The more you can get it to fit around your face, you don't want it to kind of billow out on the sides where air can come and go. Anything that does have a little metal bar that can allow you to try and pinch around the nose, these things aren't requirements. Of course, anything you can do is going to be in a bit of an improvement. However, whatever you can do to try and improve those numbers, the better off you're going to be.
So, I went simple, Doc. I hope I did okay. I've gone with a folded over bandana, pure gangster, pure Western style here. And
rob a stagecoach.
It seems to be working pretty good. It's really tight. I got a really good knot on the back. It's covering my nose and my mouth. Do we have a candle here, Tyler? We could do the candle test? All right. Well, we'll see if we can find a candle here. I don't know if we've got one here in the studio. But it's got things covered up pretty good. Is that, at least I'm trying, At least I'm trying. What do you think?
Yeah, no, you are improving your chances and your risk significantly. So I encourage you to do that. A cloth mask is still a very reasonable way to address this. Not everyone's going to be able to get medical grade N95s or KN95 masks. And even if they do, most of the time, they're not going to fit them appropriately.
Yeah, no.
I do think that the cloth masks are very beneficial. I do not want to downplay the importance of wearing any type of mask. Anything is better than nothing. Let me just repeat that. Anything is better than nothing.
So, and the rules say you're going to wear the mask when you go to the store. You're going to wear the mask whenever you go in any enclosed environment. And you might as well just, I keep a couple of these bandanas in my car now. And I take it off when I'm driving. But as soon as I get out of the car, I put it right back on. And anytime I go anywhere, then we go with a mask. So, this is what we're going to do for a while. We'll see how it works. Hopefully it helps. If nothing else, it's the law. And we're not going to go to jail if we walk into a store without one, but the stores can kick you right back out if you walk in without one. So, why not try it? And employers, you have to have masks available for your employees. So, thanks for the candle tip. I like that, Dr. Taweel. We'll try that one later on and see how we're doing. And no one should be wearing those N95 masks really running around in the public, right?
Well, if they have them, of course, they can wear them, obviously, but I think the KN95 masks and the N95 masks are more importantly best reserved for healthcare workers who are actually dealing with known cases to try and reduce their risk as much as possible and make sure that they have them fitted appropriately.
So can I tell you a story? Because we just like to bring this right down to grassroots level. So I'm on the phone with a friend of mine over the weekend, and their daughter, West Bloomfield resident, their daughter gets a fever over 100. It was like up to 101. So they sent her off in the car because they wanted to stay isolated. She was able to drive. Went over to Henry Ford Hospital. There wasn't really much of a line. She was tested. They're waiting for the results. Shouldn't be much longer than a day or two these days to get the results back, and then they'll know. But if you've got somebody in your house that's got symptoms, should you try to isolate from them? What do you do?
You have to. You have to do the best that you can. So if someone does have symptoms, they have fevers, you want them to at least remain self-quarantined from the public. In the house, you're going to try and do the best you can. You're going to do hand washing. You're going to try and wear the mask. Obviously, the person that has the symptoms should wear the mask as well if she's going, if that person's going to interact with people. Continue to use, precautions, hand washing, try to maintain 6 feet of distance. If you do have to interact closer with family members, if you have a child that's going to require your care, you're going to do the best you can. You're going to wear the mask, hopefully encourage the child to wear the mask. You're going to wash your hands before and after, and you're going to keep continuing to try and mitigate this spread as best you can. I do recommend also, if you are touching things, opening doors in public, just kind of a side note, try to use your non-dominant hand, because the dominant hand, if you're going to touch your face, 9 times out of 10, you're going to use your dominant hand. So if you're going to touch public things without realizing it, try to use your non-dominant hand so that you can avoid trying to inadvertently, create more spread.
See, there's just another really useful tip I never thought about. I've never heard anybody say that. Where'd that one come from? That's a great idea.
It's what happens, just kind of as if also washing hands, make sure you're getting the thumb on your dominant hand, because you tend to avoid doing that when you're washing your hands as well. So things like that. I'm trying to just make sure that everyone's getting a little bit more data.
I like that. In fact, I just added the term, Tyler, non-dominant hand, to our Corona-19 vocabulary list. Because when would you have ever said non-dominant hand up until this crisis?
Yes.
So,
you're right-handed, tend to use your left hand to open things and touch things if you can, because you oftentimes use the hand if you're right-handed, you tend to touch yourself with your right hand.
No, and it's so hard. In fact, even the governor, when she was talking about not touching her face, and she admitted it touched her face, it's one of the hardest things to do, to keep your hands away from your nose and your ears and your eyes and all that. It's difficult.
I just did that while we were talking. So.
It's really hard to do. So I like that. Use your non-dominant hand for touching things. I have this little routine when I go to the restroom where I take the towel and I wipe things off, and then I use the towel to open the door, and then I throw the towel away. So in case somebody else touched the handle on the way in, hopefully we would be okay. So best of luck to my friend whose daughter has the fever. Certainly taking medications to reduce fever, that would be okay. And we want to take Tylenol right now, not ibuprofen. Is that correct?
Yes, ibuprofen is something that has been showing to help actually propagate this virus a little bit better. If you do have it and you take ibuprofen, it can actually make things a little bit worse. As some of the data that's coming out, it upregulates. It is what's called an non-steroidal, so it can increase certain amounts of a particular enzyme that the virus uses to propagate. So try to use Tylenol to reduce the fever as best you can, rather than ibuprofen, Aleve, Motrin, things along those lines. Naproxen, another one of those.
Dr. Jamie Taweel is with us, internal medicine specialist right here in the Lakes area, and he's been our local go-to doc during the coronavirus. We appreciate it. Clearly, I'm not even going to get into the injecting Clorox into our veins issue, because that's just such a ridiculous concept that I think everybody knows, not to do. I mean, I hope everybody knows not to do that. On the positive side, we did hear over the weekend and through press conferences on Thursday and Friday that that treatments at our hospitals for COVID-19 patients are getting better. The physicians in the ERs and in the intensive care, they're learning, they're finding things out, and they're sharing that information. Are you hearing the same thing?
Yeah, I think physicians are it's been wonderful. I mean, every hospital system that I'm a part of sends me routine emails with data, all of the amount of cases that they have, things that they're doing, as well as I'm getting New England Journal articles sent to me. Physicians are talking. The medical community in and of itself has become amazing in the sense that they are just all converging and really sharing ideas and doing what works. And this is organic. It's moving wonderfully along with how everyone's interacting, and healthcare systems are working together, and it's actually been pretty inspiring more than anything else.
Well, and one of the things that I just felt better about after hearing is that is that we are much further along, even if we don't have a specific medications right now for treatment. Just the way we're handling patients. Like I heard one thing about doctors putting patients on their stomach rather than on their back, and then they've had much better results. So little things like that are big, making a big difference to the patients that we're treating. And we're getting better results. Every day, the physicians learn more. And I'm really glad to hear that you're all communicating with each other and sharing this information. And we're a lot further down the road now than we were a couple of weeks ago.
Very, very true. And Michigan does have a high rate of infected healthcare workers, which is unfortunate. But I think we're starting to realize that there's more danger out there. And so the fact that they're sharing ideas and getting a little bit more proactive, I think is wonderful. And so anything that's new that's coming out, believe me, it's getting spread. So that's a good thing. So not just bad things that are spreading.
Dr. Taweel, anything else you want to add before we say so long? I don't want to occupy your whole day, but I appreciate you checking in with us.
Anytime, and I appreciate it. No, just stay safe out there. Please be careful. Wash your hands.
All right, wash your hands and use your non-dominant hand, everybody, to open that door. That's the tip of the day. I like that. Use your non-dominant hand to open the door. Less likely that you're going to take that hand and touch your face with it. Very good tip. Thank you, doctor.
Be well. Thank
you too. Be well. He is Dr. Jamie Taweel joining us here on the show.